Hello, my name is Tenkel. I'm the product manager for the new autostereoscopic 3D display for Barco. Today we're here at RSNA and I would like to explain you how the technology works and what the added value is for us. So, the way that the autostereoscopic display works, it gives you 3D without the need for any wearables or glasses. The way that it works is there is an eye tracker here on top of the screen. It tracks the position of your eyes in space, and then through a lens structure quite similar to this kind of lens structure, we can project an image to the left and to the right eye respectively. Thanks to the eye tracker, we know where you are and we can adapt that projection dynamically, allowing for a very intuitive and easy workflow. So the way that it works pragmatically is, here we have a software from our partner that is a DICOM viewer, so we can take any CT or any MRI and you have the normal viewer that you would have in your PAC viewer, but you also get a real-time volumetric rendering of your raw data. So it does not need any pre-processing, it's real-time and it's very quick for somebody to pull up. So just to give you an example of how it will work, you can set your filters very easily and dynamically, and then you can click, once you have a good view, you can click the 3D button, and just like that, you're immediately looking at 3D content. Compared to other solutions like augmented reality headsets or virtual reality headsets, you don't have the normal workflow compromises that these solutions have. For virtual reality, you have to put it on. Some people find it a bit claustrophobic or nauseating. You have to get used to the controllers. While it gives a very good 3D experience, the workflow compromises are quite large. That's not something that this solution has. And that's exactly why it's so important. The switchability allows it to be used as a normal display. Once you want to do 3D, you click your button and you're instantly doing your 3D. Our first use case will focus on patient communication. So here, the idea is that clinicians and surgeons in particular can explain the pathology to a patient and also what the procedure is that they will undergo very easily. You can just take the 3D content, point at where your tumor is, and how you're going to tackle the tumor. Are you going to do radiotherapy? Are you going to do a kind of incision somewhere? And it makes it very easy for a surgeon to explain this to a patient. There are studies that prove that when patients understand what's wrong with them, they are more likely to opt in for the procedure as well. And that leads to higher patient satisfaction scores. It also leads to higher hospital revenue just because you get higher opt-in. But in the end, it also leads to better patient outcomes because the patients actually get the procedures that they really need. Thank you so much for your attention.